hospitals are noticing an increase in COVID-19 admissions with the recent uptick in cases. To tell us more about this, we have Private Hospitals Association of the Philippines President, Dr. Jose de Grano, joining us this afternoon. Dr. Grano, magandang hapon po. Good afternoon.
Yes, good afternoon, Risa, and all our listeners. Opo. Yes.
Doc, would like to know, how are private hospitals doing now, especially with the recent increase in COVID-19 infections?
Well, all the private hospitals are already prepared to accept COVID cases, especially those in the moderate, severe, and critical categories. You know, we are mandated to open up at least 20% of our allocated beds. We have allocated 20% of our beds for COVID cases, and so the hospitals are ready and prepared to admit these patients.
Doc, in your opinion, what do you think is the main drive for the increase, again, in COVID cases? Is this still the Delta variant? Is it the mobility of people during the holidays? Or is this the Omicron already?
We are actually not sure yet because we still have to look into the findings in the genome sequencing of the cases. But most probably because of the rapid increase or surge of these new cases, most probably these are secondary to the Omicron variant. Yeah.
Doctor, saying the Omicron can be or is highly transmissible. Should we have another surge, just like the Delta in the previous year? Is our healthcare system, are the hospitals ready for that?
Well, of course, yes. We will try to accommodate everybody. As long as the hospitals are there, we'll try to... the only limitation that we have right now, yung ating mga healthcare workers, if they are not able to cope with the number of cases, then we'll have to get some more. No, we have to shift from the non-COVID to the COVID areas, and then that's the usual thing that the hospitals are doing. But then usually these cases in the hospitals are reserved naman for the moderate, severe, and critical, and usually the behavior of this new variant is milder than the previous one. Okay.
Doc, we also have received reports regarding po our healthcare workers, our nurses and doctors in the hospital, that there's also an increase in infections among them. Can you confirm this?
Yes, I think there are some reports that merong yung ating mga healthcare workers mismo po ang siyang na-infect. Most probably dahil nga dito sa masyadong highly transmissible itong new variant. So we are advising all our healthcare facilities, especially the private hospitals, to be very strict and follow the minimum health protocols and guidelines as indicated by their infection and prevention control committees in the hospital, so that hindi kumalat ito. Kasi if our healthcare workers are the ones ma-infect, then that will be a tremendous blow. It may overwhelm our healthcare system.
Doc, tomorrow Metro Manila will be an alert level 3. The government is trying to do whatever it can to prevent, again, the transmission, or rather the spread of the Omicron. As a practitioner, what would you suggest? What would you recommend for everyone to do to prevent, again, the rise in cases?
Well, that's good. Mas strict tayo. So let us, siguro, if you do not have anything to do outside your homes, and it's not important na yung pupuntahan nyo sa paglabas, I think we should postpone it right now, no? Kasi medyo we are experiencing this increase na, so that's why we are very strict now. The level was increased, so let's not wait for level 5 to control the movement of the people. So right now, kung hindi naman importante, siguro yung mga tao, let's keep on ano na lang, other yung mga pagtitipon-tipon na hindi importante, huwag na muna natin gawin po.
Alright, maraming salamat po and stay safe. That is PHAPI President Dr. Jose de Grano.
Thank you, Lisa.